And we're going to be talking to Jake Renier, someone who has gone through a tremendous amount of weight loss.
Yeah.
It's actually a fascinating story, and you wouldn't believe it when you see him today that he had a weight problem ever.
Jake, thanks so much for joining us.
Thank you for having me.
Yeah.
And you brought your own water. Very good.
That was a quick change. Just hand the mic over and come and sit down. And
Hi, everybody.
you look great. You
Thank
feel
you.
good, I assume.
I feel amazing.
Yeah.
Really do.
Tell us your high end, yeah.
Well, my high end, I've lost 130 pounds overall. I started off at, I think my heaviest was like 275, or 375, excuse me.
And 275, you had me frightened there for a moment.
I think it was about 3 or 4 years ago, my primary doctor told me I needed to get serious about weight loss. And my diabetes was out of control. I'm type 2, have been for almost 20 years.
How old are
I would
you?
say. I'm 42.
You look much younger, I have to say.
Thank you. I hope it stays that way. And then I actually talked to my doctor, basically told me I can't guarantee 10 years if you don't do something. My blood pressure was way, way high. My diabetes was out of control. And I was on all kinds of medication.
And you did physical work.
Yes.
So how did the symptoms show up there?
Well, I couldn't push the wheelbarrow up a hill. I got tired right away. I started work at 7. By 9 o'clock, I was tired.
What do you do?
Landscaping.
Oh, okay.
Utility work.
So what was the trigger for you? What was the everybody hits I want to say rock bottom, but that's not really fair, but they hit something in them says, I've got to make the change. Because you've been dealing with it, right? I mean, you've been trying to deal with it. You probably tried this and that. And
exactly.
What was the wake-up call?
When I hit the wall, it was my number one, my doctor telling me about the whole, got to do something now. And my life is, my whole family has diabetes in it. My mom and dad. My mom was diabetic, type 1. My brother was type 1. My father was type 2.
Wow.
I have an 8-year-old son who was type 1. He's actually using the CGM and the pump.
Okay.
So I knew there was something that had to be done, and I wanted to be around. So that was the biggest one, when I knew I had to do something to be around for my son.
So was your first thought dieting, or was your first thought more drastic than that?
I've tried diets, you name it, I've tried it. When I was 375, I went on Weight Watchers for a little while. And that only took me to a certain point. After so much, you have to do something to go a little further. And that's when I looked into other options for weight loss, because I wouldn't go in any further. So.
Talk about that in that process. Like, what was that? Yeah, the whole everything.
Well, my doctor told me, this was 2.5 years ago, my doctor spoke to me about weight loss surgery. And there was 3
Which is a
different
big
kinds.
decision
It's
to
a
make.
huge decision. And I've put it off time and time again over the years. I was like, yeah, I can do it myself. I don't want to worry about that. And then eventually, he moved into an office that was directly across from GBMC's Comp Weight Loss Center.
Okay.
And I walked across the hallway and I met Dr. Dovek and the people there, and I knew this was for me. And the first thing I did was go to an information session. And I got the info I needed, and that was where I started.
And what options were presented to you at that point?
There was options where it was a gastric sleeve, a gastric bypass, and I'm drawing a blank.
You can chime in.
But,
Do you remember?
oh,
Okay.
sorry.
Back then, was it a balloon?
Back then there was different ones, yeah,
Okay.
but we don't
Okay.
do that anymore. So, but go ahead.
People are concerned about what the recovery's like.
The recovery, what it does.
Yeah.
I didn't know how long I'd be out of work.
Right?
But I was literally out of work for like 2 weeks, and then I went back, and I was good to go for my
2 weeks.
It's all done. It's all done laparoscopic, and it's pretty quick. But if you follow what they tell you to do, it works pretty well. It works great.
And when you say that, what does that mean?
As far
When
as
you follow what they tell you to do?
their program is so defined, where if you follow exactly what they offer you and tell you what to do, it works. Now, not every patient has the same outcome. There's things you have to work out. It's all going to be, there's things you have to do. And that was the hardest part, is just following the book. They give you a book, a binder, and then you stay in touch with the doctors in the office, and it works.
Now, you said you were back to work after 2 weeks.
I was back to work after 2 weeks.
But you're still at a very heavy weight level at that point. The weight doesn't go away.
The weight doesn't go away right away. I mean, you lose once I started the program. I do a 6-month or 7-month program with a nutritionist, And after that, I lost, I think it was like close to 50 pounds just in the first 6 months.
Wow.
And then after the surgery, I started losing more and staying active and eating healthy. It was a lot of high protein, low carbs, and that's basically where it came down to, is eating healthy.
Can you describe it? Because people often get a little freaked out when they think about, I'm not going to be able to live with this plan. I don't know how I'm going to manage this plan. Is it 6 meals a day? Is it 5 small meals? Do you have to measure? Do you have to go buy specific foods? All that kind of
That's
stuff.
very good, yes, because a lot of this is, when I say detailed, it's all about the when you eat, how much you eat, what you're eating. The biggest thing is what you're eating is you want to fill up on proteins and lose the weight. You fill up on proteins and keep your carbs low, you'll lose more weight, plus your body's getting what it needs. It doesn't need all the extra carbs. It really doesn't. In the morning, I would eat a normal meal. Breakfast would be eggs and maybe some spinach on them, or salsa. And then lunch, I would start taking a lunch. I would take a snack, just a piece of chicken breast, and that's what I would eat for lunch. And the guys at work, I mean, they were always backing me up at work. We would go to certain places where I could get a good meal where it was high proteins. And then dinner was just a sensible dinner. But it was all, and fluids, it was all about fluids. A lot of people don't realize they don't get the amount of fluids they're supposed to get in. And then dehydration, and that plays a key toll
So
on it.
if you eat that way, how did the surgery then help support that? Was it that you just didn't want to eat a lot of it, or?
You
know what I'm saying?
You learn to eat totally different. When I had the surgery, I had to learn all over again how to eat, how to live, because basically when I would eat, I would just start eating and eat and eat, and then eventually I'd feel full. But by that point, you've already eaten too much. So when I do it, I would eat. I'm sorry.
No, go ahead. I'm just being
I would
texted.
eat
I have a question.
breakfast, and the tool. Basically, the surgery is a tool that helps me control how much I eat and what I eat. So I know if I eat something that's really sugary, I'm going to feel terrible. I'm not going to want to do anything, and that's the biggest thing. It's a tool. People got to understand that that's a tool that helped me get to where I'm at.
Okay, your profile on GBMC's website talks about the fact you said you lived for food, you live to eat.
Oh, yeah.
So now you've got this surgery, and the food's still out there. So do you ever cheat? Did you feel like cheating? And what happens when you
Don
did?
wants to know what you live for now.
Honestly, everybody cheats, but there's things that you realize it's better to have something little and enjoy it than to just totally knock it out of your lifestyle, because then you're going to want it, and then when you do eat it, you're going to go overboard. So I do cheat.
What price do you pay? Is there pain?
There's not really pain anymore. No, it's not really pain anymore. But I know if I eat something too fast, if I eat too much, if I don't eat the right foods, I feel like a little, hey, heads up in my stomach saying, get back on track, pay attention. So
no alarms go off or anything?
No, I haven't experienced it. But I have learned that there's still things that I'm learning that I should and shouldn't eat, or how I eat.
Yeah.
I don't drink before or after a meal within 30 minutes of the meal. And I still do that, but I feel like if I do it, I have done it in the past, I feel that like a full feeling and I feel sick, so to say.
Okay.
So,
Uncomfortable?
yes, very uncomfortable.
Okay.
Yes.
I would imagine that you got something after you lost 50 pounds, or something had to say to you, I'm wondering about your motivation. First you had a surgery, so you're motivated to stick to the plan, but then is it the weight loss that continued to
Yes.
motivate? Okay.
Yes, the weight loss and the people
I'm on
that
a
I
roll.
meet with, yes, that was the biggest thing. And the clothing change. When I started to lose weight, I started to wear different clothes. I always wore 3X was what I should have worn, but I always wore like 4X because it felt comfortable.
Okay.
Where you almost hide inside your clothes. Yeah. And then when I started losing the weight, I started getting different sizes, started shrinking the clothes down. And at one point, I actually took my whole wardrobe and got rid of it and started going and just getting smaller clothes. And now, when that happens, you start to feel better about yourselves. You start to dress better. You look in the mirror and you're like, hey, I can do this. And that's what carries it through.
How's it changed your relationships?
Amazing. Amazing. Relationships now with people, I'm more confident. I'm more prone to talk to people and share what I've been through. And relationships all over have been so much better.
Are you where you want to be, or is more going to come off?
I'm pretty much where I want to be. There's still things I want to do to maintain, but I wouldn't mind losing a little bit more to get to where my ultimate goal. I've never hit my ultimate goal. I've been to like within 10 pounds of it. So I'm still going to work until I hit that and then go from there.
Is the wheelbarrow going up the hill any
A
easier?
lot easier. It's a lot easier. And work seems to be more, I can work a full day and feel when I get home I still can do things around the house and not worry about, oh, I got to take a nap or I just can't do this.
But you can't let your guard down, can you?
Never.
Is there a fear of?
There is a
Gaining.
fear, I think a fear of always, if just because I had the surgery, if I let my guard down and go back to eating the way I was, it's easily to go back. I believe it definitely will go back. Yeah.
Mindy, I think we have some Facebook questions, right?
We actually have a few comments.
Awesome.
I think your fan club must be watching, Jake.
You didn't tell us about that.
We have Carmela saying, love you, Jake. Thank you for sharing your story. Missy says, you are the man. You're so awesome. And Amy says, love you, Jake. I'm so proud of you. So
There you
we've
go.
got
Thank
a
you very
lot of
much.
fans out there.
Thank you, guys.
Never hurts to be stroked.
No, it definitely helps in this point.
So obviously they picked you for a reason to come talk with us because you're such a good spokesperson for the change that can happen in your life. Are you speaking out to other people, and what are the big fears that people face when they talk with you and they're kind of on the fence about it? Or do you look at people and say, oh gosh, I was where you were, I was you?
I do that a lot. I do that a lot. In fact, it's gotten to the point where if anybody ever asks a question about it, I'm open 100%. I will share any information I have. I will share my story with anybody that asks. Even people that don't, if I can just, even doing something like this, if this helps somebody make a choice for a better lifestyle, I'm for it. But yeah, it's definitely been my story. I will share it. It's not over yet. It's always going to be a journey. And I think most people will realize it's not just a one quick fix and done. It's definitely something that you have to continue.
And since we're talking about diabetes, your diabetes is easier to
I was on, prior to the surgery, I was on all kinds of medication for high blood pressure and diabetes, and now I take one for blood pressure, and that's it. That's all I take. So, yeah, my medication's off, my diabetes is under control, my blood pressure is under control. I do some running and all that
I was
kind of
going to
stuff.
ask if you've taken up any new hobbies.
Running is fun, yes. I did the Baltimore Running Festival last week, or 2 weeks ago, and I enjoyed that.
Congrats.
Thank you. I
That's
really enjoyed
really
doing
awesome.
it. And it's more or less the people that I met through this comp team and the people that I met through GBMC have just, it's a family. Like if I'm having a bad day, I can put it on Facebook, like I'm having a bad day, and they're in droves, they just come.
So it sounds like the support is incredibly important. You can't just go
Yes.
in, get the surgery, leave, and expect, you
Expected
need
things.
your village.
And I'll always be, that's why the support, they have a support group, they have the GBMC, or the Facebook Live, or the, on Facebook they have a support group. But it's definitely best to have that support group through the whole thing. Because if you don't, a lot of people they go into this and think, oh, I can do this, and then I'm on my own. Well, you got to have that support because we're all going through basically something that one of us or someone else has gone through.
Okay.
So we're going to meet challenges that say, hey, I need to do this. And somebody will say, yes, well, this is what I've tried. So.
All right. We have another question for you on Facebook, or another fan who'd like to speak to you.
We have several fans, actually. But we have a question from
I have to get your
Dominic.
autograph.
Dominic just said, I just had RNY, so that was,
Ruin why?
what does that stand for?
I had the lap band, I had the gastric sleeve. He had a Roux-en-Y, which is a complete bypass of the stomach.
Okay, so he had it at 30 years old, and you wish he had done it sooner. Do you wish you could go back in time and do the surgery sooner?
Yes, good
Good
question.
question.
Thank you, Dominic. I say this all the time. I wish I'd have listened to my doctors years ago when they offered this and told me to go look at it. But I was in a state of mind where, no, I can do this. I can do all the eating. I can exercise. I just got to stop eating all the junk. The truth of the matter is, if I'd have listened back then, I'd have been feeling much better and a lot further along now. So,
But you're
yes.
ready when you're ready.
Yes,
right? I
yes.
mean,
This is definitely something that is each individual journey needs to make.
And all of us are indestructible in our youth.
Yes.
Yes, right. We can do it ourselves. We don't need any help.
Exactly.
Well, that's. Thank you so much for sharing
Sure,
your
thank
story.
you for having me.
It is
Yeah.
pretty awesome.
If you do you have a message that you carry with you? You know, if you were going to speak to anybody right now, shortly, but
I would say take your first step. If you're interested in anything like this, or if you want to go to an info session, the best thing to do is just take the first step and try. It doesn't hurt to go to an info session. It doesn't hurt to find out information about it and just talk to other people that have been there.
Can I just ask you one more thing? And it just occurred to me, but because I know people who've gone through it and they handled it differently. But do you find that maybe there was, and maybe there still is, somewhat of a stigma to taking this route in that you can't do it on your own, or why do you need to resort to? Do you know what I'm saying? And so
Yes.
some people feel some shame in doing it.
Yes, a lot of people have told me, and I've heard this from a few people, not a lot,
Right.
but some people have said this is an easy way out. It's not an easy way out, because you have to learn to eat all over again. You have to learn to live your life all over again. And one of my Dr. Dovek spoke to me one time, and she said, years ago, food wasn't on every corner like it is now. Nowadays, it's everywhere. Everything you do revolves around food. And the best thing to do is not think about that, but pay attention to, it's not easy. You have to pay attention to the different things every day of your life.
Very good.
Be diligent.
Exactly,
Well,
diligent.
you're an awesome example.
Yeah. Thank
Thank
you for
you.
sharing
Thank you
with us.
so much for being with us.
Sure, thank you.
All right, cool.
I urge people to go on
Yeah.
GBMC's Facebook page
Good luck with your fan club.
and read his profile and things like that. It's pretty amazing.
Yeah.
It's not a long read, but it's pretty amazing.
Yeah, and if this is the time if you know someone, and also if you hi Dr. Dovek.
Hi, guys.
If you want to have someone see this interview or any of the interviews today, GBMC is going to package them all up nice and neat and put them all back out there again, so they will live on in case you know someone who needs to watch this and get more information, and that it'll be available.
And you heard Jake refer to her several times, but this is Dr. Betsy Dovek. She's the medical director at GBMC, and also a bariatric surgeon.
Yes.
And of course, he mentioned the name several times, but we should do it again. GBMC's Complete Obesity Management Program, or COMP in capital letters.
You must feel so proud.
I'm so proud. Jake did so awesome.
Yeah.
You can't pay for an advertisement like that. That was phenomenal. He did so good. I mean, he is extraordinarily successful because he really has taken this on and followed, what we have to offer. And he refers his own friends and family members. We've done a lot of them, and he's just done incredible. I'm so proud of you.
And
I don't think I've ever interviewed a bariatric surgeon before.
I don't think I have either. Which
Oh,
my first
awesome.
question is, all those specialties out there.
Yes.
Why did you choose?
What drew you to this?
Yeah, bariatric surgery.
Well, probably just after even seeing Jake, you realize, wow, I get to have a small part in a really amazing thing. And I think all of us on this earth want to do meaningful things. And I feel like I'm making an impact on the world's most staggering epidemic. I mean, obesity is such a huge problem. And doing surgery, I get to lead such a rewarding life that I get to see transformations like that every single day. It never gets old.
It's pretty cool. It's
so cool.
life-changing.
It's really great.
Should mention, it's made you one of Baltimore's top docs as well.
Yeah, oh, yes. Thank you, Don.
Always a good title to have.
Absolutely.
How many of the people who come to see you just to even start the process are dealing with diabetes? Is it sort of
Oh,
half
a
and
lot.
half? Okay. Is
I
that
would
what brings them to you, or is it more
It's you'd be surprised at how much obesity impacts. It impacts pretty much everything from your head to your toes.
I
Things like high cholesterol, high blood pressure, diabetes, sleep
Joint
apnea,
pain.
joint pain, self-esteem issues, depression, anxiety, migraines, all kinds of things. There's over 40 obesity-related conditions that weight loss surgery actually helps to treat and to resolve.
Okay, the process with Jake mentioned it briefly, but let's say someone comes across the hall from his doctor's office, comes to the COMP office, and what kind of process do they have to go through? Do you have to make sure they're not looking for an easy way out? Or?
Sure. So if you're interested, what we have you do is go to our website. It's gbmc.org/weight loss. And there patients can either sign up for an information session online or they can do it in person. We still do those a few times a month. And that's when they're going to learn a lot about it. Everybody who looks into it has tried an average typically of about 22 different diets and exercise or medications before they come to us.
Sure.
Now, weight loss surgery is the most effective tool that exists to lose weight and keep it off. And so by the time they come to us, they know a lot, but we want to make certain that they hear it from us and they really know what to expect. After they complete that info session, they then do an initial consult, and that's when we talk about you as an individual and your types of medication, your history, and what type of surgical option would be best for you.
Do people look at this as like a last resort, and should it be looked at that way?
I think that there's obviously a lot of social stigma about this being, like you said, the easy way out, the last resort. And I say the best way to compare this is think about if you or a loved one, a daughter had breast cancer. You would not even hesitate to say, get the best treatment that exists. Get chemo, get surgery, get radiation. But for some reason, surgery, which is the most effective tool, doesn't get that same sort of feeling with it. And I think it's slowly but surely changing as we have adapted and done it much safer, and our outcomes are much better as we go forward.
And it's less invasive.
It's less invasive. I do it through your belly button, so maybe
Which is
afterwards.
incredible to me.
Yeah, maybe Jake can lift up his shirt for all the fine people in the audience here and see how the incisions are hidden there.
Post that picture later.
Yes, that'll be on our secret group, Jake, don't worry.
And when you're doing the laparoscopic surgery,
Yes.
are you inserting a sleeve in his case?
No, there is no sleeve device. There's no foreign body. It's not like the lap band where there was a piece of plastic.
I remember that.
The sleeve, well, I can explain it now. I don't know if the engineers have the pictures. But right now, everybody's stomach is about
There
the
you go.
size of a football. Oh, that's the bypass. I don't know if you have the, there we go. With the sleeve, what I do is I put a sizing tube into the stomach that will become the sleeve portion, or basically about 15-20% of the size that it is now. So I put that sizing tube in, and then I use a device that staples, seals, and separates off about 80% of the stomach.
Wow.
So I pulled out 80% of Jake's stomach through his belly button, send it off to pathology, and then that was it. So his new stomach is about 15% of the size, about the size of a garden hose now.
So the black lines we see there are staples?
They're staples. They're made of titanium. They're very biocompatible, and they get incorporated into the tissue, and they're very safe.
Can
So
you
the
get on
whole
it?
white section is taken out.
It's completely removed. 80% is removed. But with that 80% that's removed, there's a hormone called ghrelin, which is what tells your brain to eat more, eat more, eat more. So when I remove that, that cuts that signal so that your appetite is greatly suppressed. So it's another metabolic change that occurs that helps Jake to lose weight that diet and exercise alone or taking the easy way out doesn't do. So that's why these surgeries are so effective. It doesn't just limit the amount that you can eat, it also helps alter your hunger hormones.
I want to make sure I understood that. By doing that, you tell the brain something as well as the stomach.
Exactly. That signal to the brain is now cut.
You're not hungry.
Yes.
Yeah, ghrelin is out of here. Ghrelin is not our friend. It's for survival, and the majority
Can
of
we just get a ghrelin suppressor?
they try that. That's one major thing with it, and then you can eat less. But yes, I'm sure they're looking for that to be in the miracle pill coming up soon. Yes.
Are there certain markers that people need to hit in order for you to even consider them?
Yes. When patients come in Maryland, we live in a great state that the majority of insurance providers cover the surgery, usually at 100%, no out-of-pocket expense. But they want you to do certain things. So like Jake said, you have to do typically a few months of consecutive supervised weight loss where we teach you, we educate you on what the diet will be like afterwards, the mental changes that have to occur, the importance of exercise. So it's not just like getting a haircut. Hey, I want a haircut. I'm here. I'll do you next week. No, I will typically see you for probably 7-8 months before I operate on you. And then after that, patients are ready. And then there's other clearances. We want to make certain we do this safely. It's elective. So we check, cardiac clearances, pulmonary clearances. We might do a sleep study. It's all individualized.
Psychological?
We do psychological evaluations on all patients, and that is not meant to discourage anybody, but it's more that you're pretty much going to guaranteed lose a lot of weight, but I want to make certain that your mindset and your habits change so you keep it off for the rest of your life.
We briefly saw the other option, so I think
Yes.
we ought to dig into that a little
Yes,
bit.
so
if
the
we can.
gastric bypass, this has been around for decades and decades, and I'm sure everybody has heard about it. With this operation, your stomach goes from the size of a football just down to the size of a thumb. So the new stomach here is only 5% of the size that it is now. Now, unlike the sleeve, I don't remove anything.
Okay.
So it's called a gastric, which is another word for stomach, bypass, because I'm bypassing 95% of the stomach, but it's still inside of the patient. It's just no longer seeing and storing food.
So why do one over the other?
It's also an individual preference. I always tell patients if you have really bad acid reflux, or if you have uncontrolled diabetes, especially type 2, or if you need to lose more weight, greater than 150 pounds, I would suggest the bypass because it's better for those three things.
And since you don't remove anything, is it repairable? Can you go back to the old
Yes,
method?
the gastric bypass is reversible.
Okay,
you
that's
can
the
go
word.
back to your original
Yeah.
anatomy. There's really no reason to do that, but that option exists. Now the sleeve, since I'm removing it, it is irreversible.
Okay, what happens in the stomach after you do the bypass?
Everybody asks me that. So it doesn't just shrivel up and die. It still has a very robust blood supply, and it's still making stomach or digestive juices that go downstream, and they meet up with the food at that Y connection down low. So that's where absorption starts to occur, at the Y, not in the normal place up high in the stomach. So there's a little bit of malabsorption with this surgery, and also restriction. And the appetite suppressant effects also exist with that decrease in the ghrelin.
So do you have is there a certain body weight composition or a number of pounds that need to be lost? I mean, do people come in and say, I just need to lose 30 pounds and
Well, you have.
can we just do this? You know,
Right. No, you have to have a BMI of 35. So if you want to know your BMI, just simply go and Google BMI calculator, and it's a ratio of your weight in kilograms to your height in meters squared. So if your BMI is 35, that's typically about 75 pounds overweight.
So we're talking about body mass index.
Body mass index, exactly.
Most gyms will do it for you too, but they're trying to sell you something else.
Yeah, everyone, look out. This is people trying to take advantage of you of every twist and turn.
yeah. So which leads me to this initial consultation. Like you come in.
Yes.
You've taken a big step by just contacting you, right?
Definitely. I always congratulate the patients at the first visit, and I always say the first step in doing something overwhelming, like I got to lose so much weight, I feel so hopeless, it's always the hardest. And once you get started, next thing you know, you're running in the Baltimore Running Festival and you're changing your life. And it happens very quickly. In about typically 9 months to a year, you've lost a lot of weight. Jake did the majority of that within a year. And so if you just think, wow, if I just get started now, imagine my life a year from now. It's amazing.
I was thinking that Jake was an atypical story
No.
because he was running in
So he's
the marathon.
Jake is very typical. Our patients work
We
so
think you're
hard.
extraordinary.
He
yeah,
is
you know.
extraordinary, and
Your
he's.
fans-
But there are
You're
many others like you. is
There
what-
are, and as Jake was saying, we have a private, secret online support group through Facebook, which I run. I just want the information out there to be accurate, and that's the place where Jake and about 4,000 other of our patients can talk on there, share their struggles, share their successes, and really reveal themselves, share recipes, all kinds of good stuff.
How many people come in and say, I've heard that after you had the surgery, I've heard of people gaining it all back. Or,
Everybody worries about
Right.
that. And the truth is, it's not because your stomach stretches back out. That's a misconception.
Okay.
It's because if you go back to old behaviors, you didn't change your mind, you didn't make new habits, you go back to drinking things with carbs, calories, and added sugars like fruit juices, sports drinks, sodas, alcohol, especially with mixers. I didn't cut you in two. Of course, you still have to drink. And so you have to follow the rules of high protein, low carbs, and as minimal to no added sugar as possible. And that's the key for all people who are trying to lose 5 pounds or 5,000.
And of course, everybody trying to be healthy, first thing they go for is a sports drink. You're saying
Oh, I know. You think
sports
regular
sugar.
Gatorades are
Yeah.
great. Gatorade Zero, Powerade Zero, Vitamin Water Zero, those are okay. But the rest, they have a lot of added sugars to them. And the new 2018 label is going to finally include added sugars. And if you want to lose weight, you need to keep your total added sugars less than 15 grams per day.
Can we just put it out there and just say, sugar is the devil?
It is. It's
Okay.
a very poisonous, addictive drug, my friends. It truly is.
I think we have some questions on Facebook, right?
We actually have a couple of your fans, I think. Some
Oh,
of your
oh,
patients
fans,
maybe
wow.
tuning in. Someone says, Dr. D is the best. She's a loving and caring doctor. That's great to hear.
That's wonderful.
And someone else said, Elizabeth, you rock. So
Awesome.
keep it up. I think a lot of people from your secret Facebook group are tuning in. So.
Yes, we put it out there that Jake and I were going to be the big celebrities here today.
Look, somebody loses 100 pounds for the first
Yeah.
time in their lives, and they're,
Yeah.
that is, they'll never forget you, ever, ever, ever.
I know, and I know I make an impact in people's lives, and like I said, it's just, it never gets old.
Do you find people, and I'm so interested in the psychological
Yes.
aspect of it, who've been overweight their entire lives and been struggling and had this sort of overweight mentality, and now for the first time ever, they're wearing smaller clothes and they have this newfound confidence? I mean, is it psychologically, sometimes that can be hard to kind of.
Oh yeah, I think it takes a lot longer for the physical aspects happen, but for the mental to catch up.
Yeah.
Like a lot of times, patients will come to the office and they'll be wearing clothes that are like 4, 5, 6 sizes too big. It's like that doesn't fit. You're no longer a 3X. You know, it's very different now. And then the mental aspects, it does impact relationships. Who you are does change, but that's not a bad thing.
Right.
And you need to have the people around you support you and change with you.
Is that important to sort of let people know who you love that you're doing this? I mean,
I think that also is a very private decision to
Right.
make. You know, it's up to the patient.
Do you like to know, though, what their support is like at home?
I do. I definitely do. And if they're not willing to tell their friends and family, then I hope that they would feel comfortable joining our group. As we're probably going to talk about here in a moment, we are doing a huge reveal celebration where I hope that those types of people will come and just share it. Even if you're before surgery contemplating it, you're invited to attend this. It's going to be on Thursday, December 7th at 6:30 p.m. at Martins West. We're expecting over 500 of our patients to be there.
Wow.
It's going to be off the charts, pretty epic. It's going to be a bunch of Jakes running around, and it's going to be incredible.
And you're calling it a reveal?
It's a reveal. So we do it sort of like the TV show The Biggest Loser, where we have their before picture up, and we announce, and they walk the red carpet. We take pictures. They're fabulous, and it's so exciting.
It's going to be a place of a lot of compliments.
And
It is.
I mean,
Yes,
there's
it's
gonna
going
be
to
an
be
easy date to remember, December 7th.
December 7th. Yes.
There are a couple questions here that I don't think we've touched on. Do we have?
We have
do
an
you
audience
okay,
question
go
too,
ahead.
so.
Yes.
I've got a question from the audience here. You mentioned the stigma of weight loss surgery. Do you feel like attitudes are shifting and that it's becoming more common and more acceptable?
Great question. Yeah, I do think it's becoming more acceptable as we are mandated to share our results, our outcomes, and our complication rate. And as we're getting slicker and slicker and more sophisticated with it, those things are pretty low. It's actually much more dangerous to drive here to the studio today than it is to have weight loss surgery. And I think because of that shift in the complication rate and how successful the patients are with the right support and education, it's showing, okay, this isn't as bad as it once was. And there was a learning curve when this was gaining popularity. And I'm sure everybody knows somebody that had it, maybe didn't do well, gained their weight back, had complications, and all that's really shifting. So I do think that stigma is being removed, especially because of very brave people like Jake coming forward and sharing their story too.
I mean, here you have 500 people coming to this event
Yes.
talking about, showing their big reveal and all their weight loss and how their lives have changed. And yet obesity is still this massive, massive problem in this country, and diabetes. So are you just picking away? I mean, what do we need to do?
So my partner, Dr. Gus Bello, and I, we want to make, like I said, a big impact, not just on this area, but in the country. And we are working right now to build a very good education tool to help to do that. And our first goal is to make Baltimore the most healthy city in the entire country. And that might seem so crazy, but why can't we do it? So I think if we start here, we generate awareness, and we build from it, we could ultimately, for the first time in the history of the world, change the trajectory of this epidemic.
Wow.
That would be incredible.
You got to start somewhere, right?
You do. And why not can it be with us here at GVMC?
One thing we didn't touch on was exercise so much, but
Yes.
someone did write in and asked, they basically said, due to my weight, I can't exercise. And some people are embarrassed to exercise if they're really heavy, but will they be able to?
Exercise is a tough one. I think people incorrectly think it's all about calories in, calories out. I got to work out more. I got to eat less. And if I can't pound out, a mile on a treadmill, then I'll never be able to lose
Which is
weight.
so hard. I mean, when you count the calories that you do on a treadmill, it's not.
It's nothing,
Yeah,
and
you're-
it's not even really effective.
You're not going to erase that piece of cake. I mean, it's just.
I think exercise is very important, but exercise is not what helps you to lose weight. Exercise does a lot of things like boost your immunity. It makes you sleep better. It improves your
Strengthen
quality
your
of life.
heart. Yeah.
All those
Yes.
great things, but it actually is not intended to make you lose weight. And that's why there's shows like The Biggest Loser. Those aren't sustainable, good ways of doing it either. So I would suggest that.
Does that show bother you?
No, it doesn't bother me because at the root of it, I can see the emotion. They tap into that emotional piece of this so much that all of us, we're humans, we're all struggling with this at different levels of this journey,
Which is
like
why
you
it's so
said.
popular.
Exactly.
People can relate.
And I think I don't think that's the best way to do it, but it doesn't bother me. I do think weight loss is this: it's an equation of weight loss surgery plus changing your relationship with food and exercise and changing your mindset, and that and only that, with all 4 pieces of that, are the tools for long-term sustainable success, in my opinion.
Okay, one more question for me, and that is, I think you've intrigued a lot of people about
Oh, good.
using this as a method to lose weight. So let's say I'm 20 pounds overweight.
Okay.
Do I suddenly show up at comp and try to get bariatric surgery?
Well,
for
the
that?
thing is, insurance won't cover it. It's outside of the indications for it. Now, if you have diabetes, for example, weight loss surgery is 98% of my patients with type 2 diabetes will leave the hospital the day after surgery on none other diabetes medications. There's something that happens that instantaneously
amazing.
improves your blood sugars.
Wow.
So if
And they don't go back to it either?
and typically it's resolved, and as long as they stay on the path and they don't regain their weight or their central distribution of their weight and that sort of thing, yes, it typically can be resolved for a lifetime. So at the Cleveland Clinic, for example, the reason why I bring this up, they allow BMIs to only be 30 if you have something like type 2 diabetes as a metabolic operation to improve your blood sugars. Also in Japan, they do gastric bypass for BMIs of 25 and above if you have type 2 diabetes, because of this amazing hormonal changes that occur with improving your insulin sensitivity.
So you're cut off. How much overweight do you have to be, or?
It's not by weight, it's by the body mass
BMI.
body mass
by-
index.
okay.
Yeah. So
You want to do your BMI right now?
you want to come in and see me, Don?
Actually, I know my BMI.
Don, do you want me to take you to the OR?
At least if you step on those little silver things at the gym and they tell you your BMI. If that works, I know.
Yeah. You're brave to step on those.
Yeah, seriously.
Well, this has been really incredible, and thank you so much for
Thank you for having
sharing.
me.
And, again, this entire interview will be on Facebook. It'll be posted on YouTube. GBMC will be putting it out there. And your big event, again, is December the 7th. But
December
that's just
7th.
for your peeps.
It's for
right?
my peeps, but peeps, maybe even the contemplation stage. So if you're just thinking about it, if you're pre-op especially, I want you to come and be inspired to know you are making the right decision. Weight loss surgery is amazing. I'm so proud to dedicate my life to this. And if you're thinking about it, I hope to see you and meet you soon.
So somebody who's watching on Facebook now cannot show up on December 7th? And
Yes, they can.
Oh,
they
be
can.
there. Okay.
Yes, come to Martin's West. The more the merrier. Introduce yourself, or hit me
Very
up on
healthy food
Facebook,
they'll be
Elizabeth A.
serving.
Dovek. Yes, I'm on there, and I accept all friend requests, and I will message you privately and speak to you about this incredible journey. So please find me.
All right, Dr. Betsy Dovek, thank you so much. That was really great.
Thank you.
Can you give her a round of applause?
Thank you, guys.
Awesome.
And coming up for us on December 13th, which is our next Facebook Live, Greater Living,
Yep.
is we're going to demystify genetics for you from newborn upwards of that. We're going to be talking to several people, and it should be an interesting thing along the way.
Yeah, they've come a long way in testing, and then there's a lot of sort of implications to that too.
I
So.
always say this, I volunteer at GBMC, and I direct people most often to the bariatric department. They're there for bariatric surgery. We're going to talk about it. The other one is they're there for what it used to be called genetic testing, which now has a different name to it. So December 13th at 1 o'clock again. Mary
Yeah,
Beth
be
and I.
with us. Are you guys all going to come too? Thanks to our studio
Thank you to the
audience.
studio audience.
It's so much more fun to play to a crowd. Thank you. Bye.
See you December 13th.